Okay, so basically this session is just for you guys to understand like how can you prepare for MPhil clinical psychology. If at all at any moment you feel that I'm not audible, just like you can inform me, and one of you can like sort of tell me that your voice is not audible. Okay. So we will begin with what is MPhil CP and should you really be doing it, and what are the indications that I can be a good clinical psychologist, and what are the contraindications that I'm not made for this job. So the thing is why I'm putting it in. I mean, like yesterday, I had an experience where I felt that anybody who wants to come into this field needs to understand what is ahead in the field also. So the thing is, MPhil CP, as you know, is for anybody who wants to be trained in clinical psychology, wants to work in the hospital setting, or at least work with real patients, like those with any kind of psychological issues or psychological disorders, which is very different from what counselors do, right? So, if you are a counselor, if you're an MA psychology and you're seeing patients, then ethically you're doing wrong. You can be sued for doing so, because only RCI recognized clinical psychologist can see patients with any kind of psychological disorder. All right. So I'm currently doing my clinical psychology from NIMHANS. I also cracked RML and CIP clinical psychology papers. Although I wanted to join CIP, but because I was still in my masters at that time, so I didn't had my mark sheet with me at that time, so I couldn't join. But thankfully, I got into NIMHANS, so I'm in NIMHANS right now. Why I say that you need to be really sure is that it's very emotionally taxing. The job itself is very emotionally taxing, and somebody who's very emotionally sensitive, or at least is very sensitive to any form of emotional cues, will not set well with this job. So I mean, just yesterday I had one patient who was actively psychotic at that moment, and she was talking to a person she says she sees in the room, and it was really scary for me, because although I've seen the patients, it's very difficult when you're doing an assessment to sort of see the person talking to somebody else. And at that moment, but if you're somebody who gets easily irked by these things, scared by these things, or anxious by these things, that you would not fare well in this job. And I know a lot of people in my class. It's just been 2 months, and they're still they're not able to cope with the demands of the training itself. And not that they're not doing well, but they're just not mentally well at this moment, just 2 months into the course. And it's not even difficult yet, because I feel that it's still manageable. Yeah, so this is one thing that you have to remember, because the training is very rigorous. Especially I feel that in NIMHANS they make you do anything and everything. So my day starts at 7 a.m. and it ends some days at some days it's very good. So some days I do come back at like 5 or 4, but some days it's quite difficult and I come back at 8 or 9, and you only have Sundays. So the thing is, I was teaching at CISIUM, and then I stopped teaching. The reason being that from Monday to Saturday I'm working, I come back, I prepare, and then I teach. And then on Sunday I just have this one day, and I was also giving that one day to teaching. So I felt that after a while it will take a toll on me. I won't be able to cope up with the training itself. So that's why I have asked sir that I would not be able to continue, maybe in the future, but not right now. Yeah. How did I do my preparation? So what I did was I got in my first attempt, right? So at that moment, when I was preparing, I was doing my internship. I have been doing. I work as a part-time teacher. So, and not teacher as in psychology, but like I 10th standard, 11th standard, and I was also working somewhere. So I had a lot of things, and plus college, obviously, a lot of things in my plate. But I did well, and I feel the reason being that I had a lot of things in my plate. I feel that that was one reason. That was I was being pushed to study as well. So I sort of had a timetable that I was rigorously following, and I followed it for like 1 year straight, if not less. So for 1 year, I had a certain amount of time per day that I was giving to my studies, and certain amount of day that I was giving to. I have a nephew. If some of you know me, then I have a nephew that I was taking care of full time. So he's also a mess. So um, it at times became very difficult, but no matter what happened in my day, no matter what I have to do, whether it's my birthday, it's somebody else's birthday, I made sure that I would study whatever I'd made in my plan. I would study that. So I mean, I had a list of books, and those books were assigned a certain month. So say for example, social psychology, I gave it say February, and then general psychology some other month, and abnormal psychology some other month. So every particular topic was assigned a month, and I had to do it in that month, or else I would not do it at all. And if I don't do it, it'll take I'll get very anxious. So I made sure that I completed that, and everything that I've studied it twice. So any book that I went through, I've talked to a lot of you, I feel, and I think I've told you that revision was my plus point. So I've revised everything, if not twice, like I've not like twice is the minimum I've revised everything. So that is something that you'll also have to like do, because revision is a must. Like at the end of the day, revision is what will keep you, what will keep the answers in your mind. um, how should you do the preparation? I would say just create your own timetable. Everybody has a different way of studying and a different time that suits them. So for me, I'm a night reader. I work well if it's something I have to concentrate. I work well when I can completely immerse myself in it, which is at night time. So I used to study from say 10 or 9 p.m. to 6 a.m., 8 a.m. Okay, so that was my time at times. Not always. Okay, so you will feel that, I've studied a lot, 6 hours, 8 hours. No, that's not true. Some days it was just 2 hours, 3 hours also, but I've studied every day consistently. Okay. Uh, how should you prepare is just make a timetable for yourself, whatever suits you. Similar to what I did, just give every topic a month and follow that. If you don't have that kind of time, you don't have a year to give to the preparation, then at least give particular weeks and particular days to particular topics and follow through with it, because that's the most difficult part. It's easy to make a timetable, it's easy to make, that I'll do this, I'll do that, but it's the most difficult to like sort of follow through with the timetable. Okay. So this, I think yesterday also somebody was asking me, was the paper easy, was it moderately difficult, or was it very difficult? So for me, the experience has been different. So CIP and NIMHANS I felt were very easy. If I have to, I've given only 3 papers, I've cracked all those 3 papers, so I can only give you, insight into all these 3 papers only. uh, just 1 minute, guys. Okay, I have to allow certain students. Okay. Yeah. Okay. All right. So, was the paper easy or moderate or difficult? I would say NIMHANS was the easiest of them all. Okay. So, um, I I actually did not expect the paper to be this easy, and it was very scary, because the thing is, so I attempted in NIMHANS, I attempted 98 questions. There were 100 questions, I attempted 98, and the paper was very easy. So now the thing is, when I went back and I checked, I had made like around 5, 6 mistakes, and I was really scared, because I felt that the paper was very, very easy. Everyone is going to get at least 95. So, if I've made 5 mistakes already, I'm already in 91, 92, right? But the thing is, that's the best part about NIMHANS. I feel that they make the paper so easy that people attempt a lot, and they make a lot of silly mistakes. So when you attempt at least NIMHANS, for that I can give you the insight is that, at least only answer those that you can, and try to answer at least 90. Okay. And you have a lot of time to just try to like revise everything, just go through all the answers, question whether you've done it correctly or not. Don't just sit idle, or don't just do nothing and be like, okay, I've done my paper, I've done everything correctly in the first go, and let's just submit the paper. So make sure that you answer everything correctly, and at least answer 90 questions. And this is something that Fahim sir told me, who is the who's the founder, I would say, of CIPM. So the day that we were supposed to give NIMHANS paper, he gave us a message, all of us who are like their students. So he told us to at least attempt 90 questions. And the thing is, when I was going for the paper, I was thinking that, I will not give any wrong answers. I will make sure that, I answer every, only those questions that I'm 100% sure about. But when he messaged and when he informed us, or reminded us that, if you're doing only 80 questions and you're doing all of them correct, then you're not getting in, because the cutoff usually goes from, like it's usually 95, 94, 93, like the first cutoff. Like after that, the people who are like in general, if you're not getting around 87, 86, you're not getting in. So even if you've attempted 80 questions correctly, you're not getting in. So that is what I had set in my mind, that at least I would answer 90 questions, even if I don't know for them for sure. And that happens in any paper. We're so scared that we'll do some mistakes or we'll do something wrongly, that we tend to double question ourselves whether we're doing it correctly or not. So it's very important that you remember one thing. uh, Try to answer at least 90 questions, and that goes for even CIP. You don't have negative marks, so you just go for all the 100 questions. There's nothing wrong in doing that. With RML, I think there's negative marking, so make sure that you at least answer at least say 90 questions, because although we don't have the cutoff, but people usually give the answer, and if you're answering all 80 correct but you're not getting enough marks, you're still not getting in. That's one thing. um, so of all the papers that I've given, RML, NIMHANS, and CIP, I found RML to be the most difficult. The reason being, I don't know why they made the paper so difficult, but I found it to be very difficult. Then I would say CIP and then NIMHANS. So if you're preparing only for RML, make sure that you study everything, because the paper is very difficult. I was a first ranker. I don't know how, but yeah. And for CIP, I would say there's only specific books from where they ask the questions. So if you prepare from those books, you're going to get in. For NIMHANS, there's no specific book. You just hope for the best, prepare and hope for the best. So these are the books that I refer. If you want to take a picture, you can take, or you can take a screenshot if it allows. So for general psych, I prepared from Morgan and King. Atkinson and Hilgard, I only used like few parts of it, not the entire book. But Morgan and King, I think I revised like 3 to 4 times, because I prepared from it for my masters also, and in CIP they do ask questions from Morgan and King. Okay, am I audible? Because I can't hear you also. Just can somebody tell me if I'm audible or not?
Yes, ma'am, you're audible.
Oh, thank you, thank you. Okay, statistics. I prepared it from Aaron and Aaron. That's my go-to book. It's the best book that there is for statistics. Very good examples. You get to learn a lot. And Sydney Siegel for non-parametric statistics. But I don't think you need to go through it, because there's not any question from statistics actually. There's only few questions, none from non-parametric. So you're good to go if you go do only Aaron and Aaron. Personality, I did from 2 books. So it was Lindsay and Hall and Schulz and Schulz. In my personal experience, Lindsay and Hall is a very old book. So the thing is, I feel it's very scattered in its content. So sometimes it becomes very difficult to get make sense of the book itself. So if somebody wants to understand all the personality theories, who's given what, their history, then Schulz and Schulz is your go-to book. Cognitive psychology, only relevant parts. For example, I did attention, sensation, perception, decision making, problem solving. I think all of this from Galotti and Sternberg. So any of those books you can use. Okay, make sure that you study attention, sensation, perception for sure, because questions do come from this. Psychotherapy, clinical psychology, abnormal psych. Abnormal psych, actually, I have not prepared. So just a minute, guys. Okay. So abnormal psych, I've not studied. I did not prepare for abnormal psych. I know, like, I'm not going to give. another month of particular thing. So I just prepared psychotherapy and clinical psychology from Hecker and Thorpe. I've studied that book twice. Corey and Neeraj Ahuja is very important for anybody who's preparing for CIP. So because last time also they asked a lot of questions. It's a very difficult book. If you're thinking of giving CIP next year, start Neeraj Ahuja now, and at least read that book at least twice or thrice, because you're not going to understand anything in the first book. Social psychology I did from Barron and Hogg and Vaughan. The thing is, Hogg and Vaughan is a very research oriented book, so it has a lot of research, but not like specific definition of things and specific theories. So I think Barron is the best book for social psychology. I would suggest anybody who wants to study social psychology to go with Barron. History I did from AK Singh. I'm not a fan of any Indian psychologist or books by Indian authors, but the next perfect book for history was Herb in Hand, which is quite comprehensive, but it's very huge. And I felt that the kind of it was very complex, and AK Singh had dumbed it down to a little, to say, for example, level of complexity. I used Groth and Marmot and Gregory. You can use any of those, but like Groth and Marmot has like specific chapters for specific tests, so it does help. But I don't feel that you need to learn these tests in such depth as is given in Groth and Marmot. So if you want to just study psychological testing, Gregory is a very good book. For all additional study material, I used Cysium's notes. I forgot to mention here, biological psychology. I used two books, so it was Kalak and it was Carlson. Okay, so if somebody wants to sort of study biological psychology, then that is the perfect book. Any of the one you can use, but I used both the two books. Like I studied from two books for some reason. I was a little crazy about these things. Um, for all additional things, I use Cysium notes and MCQs that they prepared. It was the best. I was preparing from it all throughout. Especially, I feel that Cysium has been really helpful because so I was given. Okay, somebody saying something. 1 minute. Okay, somebody's mic is. Okay. Whose mic is on? Okay, is it Zafar? Okay, I think it's okay. So, just a minute. Yeah, so Cysium has been really helpful because the thing is, I got a scholarship from Cysium, so actually didn't get, like, I didn't pay anything. I was given all the services for free. So I feel that I really owe a lot to Fahim sir, because even when it was just a scholarship, and it was, I didn't pay anything for the notes, for the classes, but he really put a lot of effort into making sure that I'm studying. And the 1 month when I applied for CIP, got into CIP, didn't work, but they didn't allow me to get admission. I was really sad. For a month I did not prepare anything. I was just, I was not getting the motivation to study at all. So he was very supportive at that time, and he like sort of brought me back to reality and brought me back to that space where I can start studying again. So I feel that the kind of um, personal investment that he makes to every student, it's very helpful. And I think anybody who's who studied under him and who's been under his guidance would say the same thing. Yeah, so I'm done. If you have any questions or queries, you can ask me now. Okay. All right. Just
Ma'am, can you repeat the books on biological psychology in the chat, please?
yeah. Wait. Okay, guys. I'll just put the screen again. You can see the books. I'll add the name of the book there only. Okay. Just give me 1 minute.
Thank you. Okay, ma'am.
So this is the list of books. If you've all gotten it, I can move forward with that book that I said for biological psychology. Okay. So for biopsych, I used Carlson and Kalat. Okay. Is it visible?
Yes, it's visible.
Yeah. Okay. You can just note it down so that we can move forward to other queries. Okay. Yeah. Why don't people?
Hello, ma'am.
Okay.
I
Yeah.
have a
Just give me
question.
1 minute.
Sure, sure.
Yeah. Have. Yeah. Yeah. Okay. You can ask. Yeah. Yeah. I'm so sorry.
Yeah, no
Yeah.
problem. So it is not related to the entrance exam per se, but about
Okay.
NIMHANS. So what I've heard is
Yeah.
that you need to know Kannada in order to, get into NIMHANS. Like after you might get in, but in order to interact with the patients, you need to speak in Kannada. So is this something that you've observed in the past 2 months?
So I'm from Delhi. I don't know any Kannada. Okay, Kannada gothilla. Okay,
Yeah.
but yeah, yeah. So, but the thing is, most people who are from this place, most would know English or Hindi. That is one thing that I've noticed. But usually people from a very lower socioeconomic strata do come and they don't know any Kannada. The thing is, that's why they have like, six additional seats for people from Karnataka, so every unit has one person who speaks Kannada, so that
Oh,
those
okay.
cases usually go to Kannada speaking people. But a lot of people from West Bengal, a lot of people from Bihar, a lot of people from Madhya Pradesh. I mean, it has been in some, yeah, it has been like around 2 months,
Right.
and I get as much case, sometimes more than my Kannada counterparts.
Okay, that's great.
Some,
That's great.
yeah, yeah. So I don't
Yeah.
feel that if somebody's mic is unmuted, can you please mute is, yeah, because yeah, thank you very much. Okay, so I get as many cases as anybody in my class. I think sometimes more, sometimes I have to wait more. So Kannada will not be any problem. In fact, I like the language so much. I'm trying to learn it a little bit. So I mean, I'm definitely not going to be as great as them. But yeah, I'm definitely looking forward to learning the language. There
Yeah,
is no
actually, even I
interview in
was
NIMHANS,
thinking,
guys. There is, yeah. What were you thinking, Snehal? Yeah.
yeah, yeah. So even I was thinking that I should get a hang of Kannada. So basically, I've done my master's from Kasturba Medical College, Bangalore. So I was 2 years. I was doing my MSc there. So I did hear Kannada, but I was not able to pick it up. So now that it is my gap year, I was thinking I should learn Kannada so that it will be easier for me next year. Like if I do get into enhance.
Okay. No. I don't think so. You would need that. And if you're from Karnataka, then you have a plus point. If you're not
No,
from
actually, I'm
Karnataka,
not.
then
I'm not.
then there's no point of learning another language.
Okay, all right, noted. Thank you so much.
Yeah, no problem. Yeah, somebody asked me about interview. NIMHANS does not have any interview, guys. So you don't need to prepare for anything. Okay, I didn't have to go through any interview.
I have a question. Hello.
Yeah, yeah.
Yeah, actually, I just want to ask that I'm preparing biopsych from Pinel. Sorry, from
Okay.
Salat. I'm preparing
Yeah,
it from Salat, but I think it's way too detailed, and I've done already prepared from the notes of CIP. Plus, the
yeah.
CP techniques and all I've done from Kaplan and Sedok pocket handbook of abnormal psychology. That book.
Okay.
So do I need to do it from the other book which has the ICD-10 portion, the one which is very famous for abnormal psychology? Do I need to do that book specifically?
No, I don't think so. So see, the thing is, when I was preparing, I studied from a lot of books that I feel that it's very extra. I mean, it was not needed,
Right.
but I still did. So if you're doing biological psychology from any
No,
book, I don't
because
feel you. I
my
don't.
core areas are abnormal psychology. I have published 2 papers as well, and one in psychoanalysis and another in dream analysis. So
Okay,
my major areas are there, and I did an advanced diploma in counseling psychology from Jamia itself.
okay.
So,
So what
so
is your area of interest? Is it clinical
my
psychology or it's
yeah,
biological
my area of
psychology?
interest is clinical psychology and psychopathology.
Okay. So see, the thing is, that's one thing. If you're preparing for clinical psychology, it's very unlikely that they're going to ask you. Like there were only two questions from clinical psychology in NIMHANS paper. Those two, anybody who studied psychology would be able to answer. So giving like a month or two to like
And
just abnormal
also,
psychology,
yeah,
especially when, yeah,
okay, I have one more question. Do I need to do the history of Indian psychology? Uh,
no,
because that's my weak area.
no.
Are you sure?
Yeah. I didn't prepare Indian psychology. I got in. So yeah.
Because that portion I'm finding it way too tedious and I'm not having enough time because I consult online as well. So that's why. Okay, then thank you so much.
Yeah. See, the thing is, uh, Indian psychology, they do not ask in MPhil paper. Not that I've not come across any MPhil paper that asks any question from Indian psychology. But in NetGRF, they do ask. So if you're preparing for that, you need to know. Yeah.
Okay, thank you.
Shifa, it's making your. It's. Can you mute yourself, please?
Yeah, I am. Thank you.
Yeah. Thank you. Yeah. Anybody else? I'm just looking at all your questions now. So give me a minute. Those of you who have tapped. Okay. Uh, yeah. Uh, if you're preparing for MPhil Costa, if you're preparing for an MPhil entrance for next year, then you have a lot of time. Like it's August right now, September, October, November, December, and then 4 months prior that. Like you have 8 months to prepare. You can 8 9 months. Yes, you can. 3 months enough to prepare for CIP exam. See, I'll tell you what. Yeah, it is. I would say for CIP, definitely, if you already at least try to like learn a little bit of like read Neeraj Ahuja a little bit, 3 months is more than enough. I don't think NIMHANS is any two attempts policy. Okay, I don't know where you got this information from, Swati. Just check. There's no such thing. In fact, if you're uh, more like if you are of more age than the other person who you're time with, you'll be given more preference. So I don't know where you got this information from, but it's not true. Research methodology is you can prepare from any books, and yes, you need to study because research they ask research and stats they do ask, not very deep, but they do ask. There is more than enough time to prepare for next examination. Shreya, see, I was giving, I would say, 6 to 7 hours every day to my MPhil preparation, and yes, you need to prepare your own detailed notes. You will get your marks. Okay, so if you're preparing for NIMHANS, you will get your scores. You know how much you scored. Okay. Yeah, you can. Who was asking me about whether they can, um, prepare for you give NIMHANS entrance in 2023 if there's in their master's third year? Yes, they can because I give like that only. So you can definitely you can. without any coaching, is it possible? Definitely yes, it's definitely possible to crack MPhil entrances. So I was not in CISIUM until December, right? And I gave my NetGRF paper then. In November, I cracked NetGRF, and NetGRF is more difficult than MPhil entrances. So you can definitely crack any paper. I would say CISIUM helped me in revising everything. Whatever I was preparing, I was revising. And I will tell you, see, it's about giving time. I was fasting at the time when I was preparing for CIP. So I used to be like didn't used to eat anything until 6, 7, 7 in the evening, and we used to have classes from 5 p.m. right? So from 5 to 6 and 6 to 7, I didn't used to eat. I mean, I'm hungry throughout the day, and then I hadn't eaten anything. And even at 7, I would just have one bite of something. I'll drink water, and then I'll start studying again. So it's not that it's it has been easy for me, but uh, I think that I was dedicated. I would say I was consistently dedicated to what I was doing. That is my only plus point. That's my strength. I'm not very intelligent. I'm not very intellectually. I have not a lot of information, but I was dedicated. Yes, Neil, you want to ask something?
Yes, ma'am. So you mentioned that you cracked JRF also. So and
Yeah,
when I looked at the matrix of NIMHANS, they do have 2 or 3 seats allotted to people who have cracked JRF.
yeah.
So how did you decide which section to opt for? Like did you go for the general when you were filling the form? Did you opt for open category or did you opt for external fellowship?
So when I was filling the form, I went for external because if I'm from general, I only have 10 seats. If I have external fellowship, there are 13 seats for me. I didn't want to take, so I wanted more seats for me so that I had more chance. Um, so yeah, I mean, I opted for external fellowship and I got in, and the seat that I was offered was for external fellowship. So I can't change that. Even if I want to use NIMHANS's institutionally money, I could not because I've already given external fellowship.
Right,
So yeah,
right. So, how many seats are there exactly? Three for
three,
external?
three.
Right. Okay. So,
Yes.
I mean, but like from your point of view, what do you think? Which is the safest option? Because still, in unreserved category, there are still more seats than external, right?
See, I'll tell you what. So what
Yeah.
happens is when you give external fellowship, it doesn't mean that they'll not give you seat in the other 10 seats. Are you understanding? So if you're
Oh,
the
oh,
yeah,
okay. I had no idea
yeah,
about this.
yeah. So when you fill for external fellowship, if you're the first 3% with external fellowship, you'll be getting that seat. Okay, but if it happens that the first so the list comes out, right, and the first 3 people in those lists, rank 1, rank 2, rank 3, are external fellowship, they get the seat, and you're like say rank 10, you will still get the seat because now you'll get into general, you will not get into external fellowship.
Okay, okay. I did not know this. So the thing is, I finished my
Yeah,
master's and I did give NIMHANS exam, but I got the
yeah,
75th rank.
yeah,
So obviously I didn't get in. So I mean,
yeah,
like you said, the paper was easy. I mean, I did find it easy. I felt like I had answered most of the questions correctly. But I think, like you said, the questions were so easy that we tend to make silly mistakes. So I think I
yeah,
lost marks in negative marking. But that's what I was
yeah, yeah.
wondering, that should I opt for, like, should I give net JRF this December so that if I do have that certificate in hand, it would benefit me in some way.
Yeah, it would definitely, it would
Okay.
benefit you. So you can go for it if you get JRF.
Okay.
Ujani Mukherjee, yeah, I just wanted to answer that I did not use any other MCQs apart from Cesium because I did not have the option to. I only had once, and I think Cesium MCQs were more than enough. NIMHANS provides stipend, yes. I told you already. My strategy was divide every topic into months or at least weeks and try to complete it in that targeted month or week. That's it. That was my strategy. And I'm somebody who will get very panicked like I panic a lot and get anxious if I'm not able to do it. So I knew that I will do it no matter what. I don't make notes in copies. So the books that I use hard copies, and I write in the margins of that book. And when I'm revising, I just see through the margins. That's it. See,
So where did you get the
Garima, I
hard
would say
copy?
one. I got them all printed, so I put a lot of money into all this, getting these books printed and then
Because
because I can't study with a soft copy. That's one problem with me. Safar, your voice is not clear. Can you get a little bit of internet and then question me? Is when I'm trying to redo, I can see. See, the thing is, yeah, SG, you want to ask something? It's a follow-up question, I feel.
No, I meant like the books are very expensive, like you get them from Amazon or
Yeah,
anything.
yeah. So that's what I said. I got them printed. I didn't buy them. I got the PDF, got them printed. The books, see, Radhika, I did not prepare for NetJRF separately. I was preparing for MPhil with the same preparation. I've given my NetJRF and I was lucky enough to crack it. That's it. I cannot guide any of you as to what to do for NetJRF because I was genuinely preparing for MPhil. I was not interested in NetJRF at all. Now that I'm into the field and now that I'm learning what all I want to do and everything, I want to do research in a particular area. So I might be using my NetJRF for a PhD after MPhil. But yeah, I did not prepare for NetJRF. No, Sunita, master syllabus is not enough. You have to go deeper than that. It has Tanvi. It has been amazing. I get to learn a lot every single day, so it's been amazing, and that's what I say to all my friends. I love NIMHANS, but I hate Bangalore. So yeah. I don't know, Shufra, if the MPhil CP and PhD paper are same or not. So yeah, the main areas I don't know. Like I can't like boil it down to some topics. So yeah, SG, you can please unmute and ask me. I've been asking like you to unmute and ask me a question. Your hand is up. Uh, yeah. Ibas, they'll open someday. So, cause the wait for that. I don't know how to tell you or what to tell. Garima, I'm sorry. I was just saying the same thing that if you're really interested in the field, try giving it again. That's all I can say. Uh, uh, and if you feel that this is something that is not for me, then you can maybe start seeing other fields that you want to pursue as well, because I know that MPhil is a very competitive field. I mean, at least the entrance part of it. So it can become very difficult for some people at times to cope up with that. Uh, I don't know, Rachna. I don't know how I manage all of that now that I see, because I'm right now I'm not studying at all. I'm just doing the hospital work and then coming back and then doing something and then sleeping. That's it. That's all my life. It's very difficult right now to like focus on studies as well. But yeah, time management, I would say I had to, like, it was not an option. I had to study. I did not celebrate my birthday the last year. Last year, yeah, this year, I think. Yeah, I did not celebrate my birthday. I did not go out to meet my friends. I completely shut down all social events because I wanted to focus completely on it. And it helped because it was COVID time. So, anyway, we're not allowed to go anywhere. So, yeah. If you guys want to ask me a question, please unmute and ask, because the thing is, my chat box is itself like sort of refreshing, going up and down. It's very difficult for me to like. Demands doesn't provide placement. You don't need placement from demands. Like, you will sell yourself as you go out. So yeah, placement is something that you don't need to worry about. The name itself is more than enough.
Can you talk about your interview experience at CIP?
So CIP, the questions were very generic. I'll tell you this. According to my opinion, the CIP is just a hoax. It's just to see whether you know the concepts or not. The entrance decides basically whether you're getting it or not. That's it. That's all I would say, because everybody got the same question, and it was very basic question. It was, and if you're a part of CISIUM, then Sir sends you all the question that is being asked. So we already knew what was being asked before. All those people who went before us, they'd already told Sir, and Sir was continuously updating everything. So we knew what questions were being asked. Tanvi, as far as I know, so if you do PDCP, you're just a consultant clinical psychologist and you can help a clinical psychologist. So if there is a private practice of a clinical psychologist, you become a part of it, but you can't really open a private practice as far as I know. It's a wrong thing to do if you have a PhD to practice, but then India is if it's not India until it's corrupt. So yeah, until you make fool of people and use them. I know counselors you treating people with psychosis and BPD. I don't know how they do it, but yeah. So everything is possible in India. Especially, I think Ujani, I did answer this question that for especially for CIP, Morgan and King, some book for resource method, take any book. For stats, take any book, and Neeraj Ahuja. That's it. That's more than enough. Yeah. Somebody asking any question?
Hi.
Yeah,
Hello. Yeah, am I audible?
yeah, you're audible.
Yeah. I wanted to ask how will you compare NIMHANS and CIP, and what other colleges or institutes we can, like put in our preference list if we are preparing for MPhil after NIMHANS and CIP?
So CIP is anyway not a very good institute. So I have a lot of people from CIP, two people who joined from CIP to NIMHANS, and CIP doesn't have a lot of prospect for any like clinical psychologists because it's very psychiatry based. So they have a lot of cases of psychosis and substance use and abuse dependence cases, and so it becomes very difficult for them to like for clinical psychologists at least to work and learn a lot. But after NIMHANS, I would say yeah, CIP is the best. Then after CIP, I would say I think RML does teach you. GMCH is very good. I don't think any institute after that. I did
And
not study cinema.
is it wise?
Yeah,
Sorry.
yeah. I did not hear you. Yeah.
Yeah, I was asking, is it wise to wait for next attempt of NIMHANS if you give it this year and you scored pretty good, and you can make it in the next attempt, or just take a good institute that you are getting this year, like RML, GMCH, or IBHAS?
Definitely, you don't need you see MPhil is a very competitive place. You get anywhere, you take the ticket. You don't choose. Okay, beggars can't be choosers. That's what I had. Like so basically, when I was giving my paper, I had nothing of this sort in my mind. Like I was like, wherever I get, I'm taking it.
Okay.
Yeah,
All right. Thank you.
no problem. Yeah, just a minute. See the interview for most of the institutes, whether it's RML, CIP, IPAS, whatever it is, it's just like for only for just to understand whether you didn't give your paper like you didn't get in as a fluke, or कभी कभार होता है कि आपको नहीं पता होता है, you get in. So just to check that the interview is not the deciding factor. It's always 90% entrance, 10% interview. So focus on the entrance part. Research methodology, there's a book called Gravitative. I used that. Okay, Gravetter, Gravetter. Yeah, so if you want to like sort of go through so many things in such a less amount of time, then I would say you get CISIM's notes because they have everything. It's in a very concise form, but everything that I've studied, they did have it. But I'm somebody who likes to study everything in detail, so that is why I wanted to study the books first and then go through the revision part from CISIM. But if you're somebody, cannot go through so many things, and he's like, मेरे से नहीं हो पाएगा इतना 4 8 books पढ़ना, then you get those notes and you prepare from there. Yeah. So whether you're from private institute or a government institute, you will be trained the same. You will be given the same training. The patient load would be different, definitely, or learning would be different, but you get a job. But here in India, there's some stereotype. If you are from a private institute, I don't think there should be any, but yeah, there is. Synopsis or psychiatry, fishes psychopathology, not really. I did study fishes psychopathology. It does help if you want to because it's very small book, so you can definitely go through it. But synopsis is a very huge book. I didn't have the time for it, so yeah. You guys have any other question? Like you can unmute and ask. Hasna Begum, do you want to ask something? If you have any question, you can ask. Okay. Because
Ma'am,
I'm not able to like go through the chat. Yeah.
yeah. You mentioned that when you were giving CIP, you already knew some questions beforehand. So is that because they tend to repeat questions through the years, or do they have different time slots on the same day?
So the thing is, the interview, right? The interview. What happened was, I told you, right? I mean, so in this on the same day, everybody gave their interview, and so some people went in early, and some people like my number was 50, right? So before that, 50 people had already gone. Some of which were part of CISIM, so they had already told sir what questions were being asked. They already informed sir,
Okay,
I was
okay,
asked this question, and sir informed all of us that he was sending messages continuously throughout that interview that day.
okay, ma'am, got
I
it.
did not watch any YouTube, Telegram. I do not trust anything but books. Remember this, it will help you always. I only study from books. I don't trust people. So, yeah. Yes, I did study every book word to word. I can answer you if you question me from those books. Okay?
Ma'am, sorry for asking so many
Yeah.
questions. I had another doubt.
Fine.
So,
Yeah.
when it comes to psychodiagnostics, like when you were studying for psychological testing, were you also studying like different tests, like what all domains they have and everything? Like how is the
Yeah.
scoring, how is the
Yeah.
interpretation?
Yeah.
Yeah. So, which book did you refer to for that?
Gregory, I refer to Gregory for that. So the thing is, NIMHANS does ask question from psychological testing. So don't know everything. Don't like go through how to interpret and everything. At least know the subtest. The what does this test measure? I think this year, Snehal, you gave the paper. There was a question on Jessel's developmental test.
Yes.
Jessel's
Yes.
test on developmental something. Yeah.
Yeah.
So the answer was developmental quotient. I know the answer because it was in Gregory.
Gregory. Okay, that's what I struggle a lot because
Yeah.
when I was giving Manipal entrance test also for MPhil, they asked a lot of questions on psychodiagnostics. So,
Yeah.
a few tests which I have administered on a few of the patients, I know them well, but those tests which I haven't used, I find it difficult to remember. So, I do not know which book to refer to. But now that you
Yeah.
mentioned
Gregory.
Gregory, I'll
Gregory.
definitely
Yeah.
go back to it. Yeah, thank you so much.
Yeah. Ujani, so for CIP, Morgan and King, Neeraj Ahuja for clinical psychology, research methods, any book that you find Goodwin, Kulik and Gravatar, any book for that. Statistics, Aaron, and also social psychology, Baron. That's it. That's why I'm saying that if you feel that I can't do these many books, you can just get PSYSIUM notes. It will be really helpful. Aparna, I don't know the full name of Gregory. You just type psychological testing Gregory, you'll get the book. Apps for doing MCQs. I only did from Wise app, PSYSIUM's app. So yeah, I'm not sure whether there is any other app for MCQs.
Hello, ma'am. Can I ask the question now?
Yeah, definitely you can ask.
Okay. Hi. So the one question I
Hi.
had is that in my enhanced paper, I saw there were many questions for the therapy part of the psychotherapies. So which book would you recommend for it? Which did you study?
Also, the thing is, I studied from Cody and I studied from Hacker and Thought, both of which I did not find helpful for NIMHANS especially. So I'm not sure which book they did ask these questions from, but I think it would be Woolberg. Either it's Woolberg or it would be Corey only. So then you'll have to
Because there's
Okay.
one question I still didn't know the answer of it. There was some
What is the
psychotherapist
question?
name Yule, YULE. If anybody had did this enhanced question this year, they would
Yes,
know
it
that
was Euler. It was Euler.
Euler now. So what was the answer? I did not
Answer
know.
was Euler. Eugene Euler.
Because I did not find it in any book I have read.
Eugene Euler. It was in Kaplan and Sedok's Pocket History of Psychiatry.
Thank you so much. Thank you so much. You
Okay,
solved my
what's
Could
the
you repeat the
question?
question?
Yeah?
Who coined the term autism? Was it autism? Really, I am forgetting.
So
Somewhat.
that's something that you'll find in any book.
That
there
is
was
given it was
there
given in
was
Kaplan and Sadok's Pocket History of Psychiatry.
and there was this one question about a psychotherapy based on I think altruism, if I'm wrong.
Okay.
So that also did not found.
Altruism. I don't know which paper you gave, guys. I don't remember this question.
Okay, maybe I did not remember it well. And the second thing is that many people I know do not have that research paper option. Like in my masters, we did not have it. So are we like in any kind of disadvantage due to that in interviews?
No, no,
It won't affect.
no. I told you all these interviews are just 10% of. See, in RML, if anybody, any of you went for the interview, I was selected, but I was already in NIMHANS. They did call me, but yeah, I didn't go for the interview. My friend went and she said that they already informed them that this is just like a thing, that just a formality that they're doing. Anybody who's up on the rank list from the NIMHANS list will be selected. If they don't come, then you'll be selected. Are you understanding? This is what
Yeah.
happens.
Okay.
And,
Thank you.
yeah.
Thank you so much.
Yeah. Neeraj Ahuja for clinical psychology, social psychology Baron, research methods any book, Morgan and Hugo general psychology. For CIP, if somebody wants to know, I'm just repeating it once again. ICD 10 for the go, don't go for ICD 11, please. At least not yet. If you want to just understand what are the differences in the two, what new diagnoses have been added, just remember that. Don't go through the entire book for this, okay? I think sir will share the recording. You can see it later on. Are there any other questions? Zafar and Swati, you have your hands raised. So do you want to ask any question? Shreyasi, Hacker and Thought. Just 1 minute. Huh? Yeah. Hacker and Thought for psychotherapy and also Corey. Okay. Yeah. Yeah, you can ask. Zafar, you were saying something?
Yeah, what, like, when do you like refer to, or like, people who coin terms, or like, whole names of some particular, disorder or something? Because like I did CIP, and I remember they had this one question about like Dracula hormone, and like I didn't connect the dots, and I was like, I was like, what is the full term and all that, and I had to Google it up later. Like, where do you like find this information?
No, no. So the thing is, I would underline all of those things, and if it's a term that is specifically given by somebody, I had my own separate page where I had written everything, and it was in my pin board. So wherever I like came and went, I used to look at that, and that's how it's in my mind. So I had notes that was on pin board. I had a board in my room where I used to like study. So yeah, that's how I remember. And not very difficult, both for NIMHANS and CIP. The question for stats and research are very easy. You'll be able to get this. If you have job experience, if you don't have job experience, if you have dissertation, if you don't have dissertation, does not matter. What matters is your entrance examination marks, right? So don't worry about all of these things. I did not have any job experience. My dissertation was still not done. I still got into CIP, into NIMHANS. Okay, so you don't worry about all of these things.
Hello,
Yeah,
am I audible?
yeah, yeah.
Yeah, actually, I wanted to ask, like, I'm having this difficulty in preparing notes. Like, I have prepared enough notes, but then after even appearing for many exams, I'm finding it like I'm lacking them because the questions which are asked somewhere in between the lines they are from, and then when you miss those parts because they were not in your notes, so we forgot to revise them. So then you feel like you what's the use of making these notes when you are not able to recall those exact lines or those exact things. So how can we remember the whole book? So right now when I'm trying to prepare it again with all those, with all that motivation, I'm still finding it hard, like how to remember it all. Like like you have so many books we have to read, and then to keep it all in our minds, do we have
Yeah,
to,
so
like, how can we? Yeah.
So the thing is, when I was preparing the first time that I used to read anything, it was a complete go through. The second time is also a complete go through, but it's very quick. I'll read the entire book, but I would read it very quick because I know now what is important, what is not. But I'll still read the entire book. The third revision is always, parts of it. So the thing is, you have to give that much time. Now that you've given so much time, it's very difficult. I can understand in terms of motivation to go through the same thing again. It feels a little uh, like very difficult. Obviously, I would say, but if you really want this, then you have to. That's one thing. I was in this phase. I can definitely understand. I was questioning myself also whether I'll be able to do it or not. And at one point, I was also feeling that if I don't get in, I'm definitely going for PhD, and then somewhat within this line. But yeah, I got in. It's very difficult. I can understand, but there's no other way. I can't give you any shortcuts or any other help rather. But I can only tell you what I did right. If I tell you any other thing, it's not really true. I did prepare pretty comprehensively. So I have to tell you what I did. It's on you whether you can follow it or not. And for you, Garima, I feel that it's very difficult. But try to get that motivation if you really want to do it. And if you don't, it's not a bad thing. There are a lot of other career options as well that you can pursue, and PhD is very good. There's a lot of prospect in it as well, and it's very interesting.
Hello.
Thank
Hi.
you.
Hi. Can I ask my question?
Yeah, yeah.
Yeah. So actually, I started studying last year around June. So I have been studying since June, and I think I've almost completed like the basic and like I have been getting shortlisted, but the thing is I'm not getting admission. So I'm of course lacking in the marks in the entrance exam. So even in CIP I was shortlisted. Even in NIMHANS I lost by just a few marks. So it's like I'm there, but I'm not there yet. So how do I prepare now that I've gone through the important books, but there's still this gap of 5-6 marks that I'm unable to reach.
Revise, revise. Whatever you studied, just revise it
Hmm.
again and again. That's it. That's your, like, that will basically help you overcome that
Hmm.
5 to 6 mark gap. And whatever
Because
you're revising, don't just go
hmm.
through superficially. Deeply, again, you try to start reading everything deeply, because could be that uh, you missed some or the other parts of the notes. So you start again the same process again, and because you're still at least getting shortlisted, you have good chance that you might get into in the next go, like if you prepare that way.
Yeah. Okay, and I asked this question in the comments also. So when I started studying, I started with synopsis. I did try Neeraj Ahuja book, but I did not personally like how it was categorized. It was like I didn't like the book, so I continued with synopsis only. So now, do I really need to do the Neeraj Ahuja's book for SIP, or
So the two things that are wrong with what you said is, A, you
okay?
went with a book that is Americanized, so it's not an Indian book. Okay, it's not a book that
Hmm.
was written, especially when you go by psychopathology. So DSM-5, nobody is going to ask the diagnosis here. Nobody cares about DSM-5 diagnosis. I
Yeah.
personally feel DSM-5 is much more better in terms of how they categorize the diagnosis and everything. They don't ask you. Okay. Second thing is, Neeraj Ahuja is basically classified in a way that is basically based on ICD. So if you're reading it, you're
Okay.
sort of in some ways understanding the ICD-10 as well. You,
Okay.
you cannot study such an important book because you don't like it. You have to study it.
So,
Yeah.
because they were the same subject, I and my friend we chose to go with synopsis, and I thought that would because it has therapies. It's a overall like it includes
I would
everything.
say there
Was
were four questions, if not less, in CIP paper from directly from Neeraj Ahuja.
okay,
I could go back and count that, yeah, this question is from Neeraj Ahuja. Four questions make a lot of difference.
okay, yeah. Because
As
now
somebody who's
again
given the paper,
dedicating,
you've given the paper, you know how much, even 1 marks is.
yeah,
So one
yeah.
mark is. So then, I mean, if you're aiming for CIP, I would say go through Neeraj Ahuja. If you're not aiming for CIP, then you don't need.
Okay, because now at this point dedicating, I think it will take a month to do Neeraj Ahuja's book. So I just
Yeah, it would. Yeah, it would. It would.
what
But that book has been very helpful. See, I will tell
okay,
you why. Because when I studied that book, a lot of the medicines that are being used in our field, especially the Indian, so you would come to know of the name of the medicine, like the terms that are used. So you know benzodiazepines and all of these, but you won't know what are the medicines actually that are being used. Neeraj Ahuja has all of them. So when psychiatrists here tell you that the particular person is on, say, this medication or that medication,
yeah.
I have answered question by psychiatrist here, like during rounds or something, based on my
Hmm.
knowledge from Neeraj Ahuja. So I would not
Okay,
discount
so
that
it's
book
an
at all.
important.
Yeah. Yeah,
Okay,
it is an important. It's very comprehensive, very short. It's very, very good book actually.
okay. Yeah, sure, I'll do. That was really helpful.
Yeah,
Thank
yeah.
you.
It would definitely help you. In my opinion, because I have been helped by it, so I would not discount a book when I have definitely been helped by it. So
Yeah,
yeah, if it's just one more book, and you've already done synopsis is much more difficult than that book. If you were able to do that book, then Neeraj Ahuja is just like 2 pages as compared to like synopsis.
yeah, of course.
Yeah,
Okay. Thank you.
yeah, no problem. Anybody else, if you'd like? Because see, the thing is, I can't see your questions in the chat. Please ask me the question here only. Anybody?
Ma'am, for
Aparna, we don't need
psychotherapy,
to connect.
which
Yeah, yeah.
good for
Yeah, I just
psychotherapies?
mentioned, Corey, Hecken, and Thorpe, and What's the other book? Corey, Hacker and Thought, and there was another book, right? Neeraj Oja, yeah.
You also said Wolberg, ma'am. Wolberg, right?
Woolberg, I said if you want to study it, you can. I have not studied that book, so I would not say go and read that book, okay?
It's very big book, that's
I
why.
will. Yeah, I know. Yeah. I've not studied from it. That's why I'm saying. Yeah. Aparna, you don't need to remember the names of the medicine per se, but you need to know what medicines are being used for what. Say, for example, SSRIs. So SSRIs can be used with depressants, but also with OCD. So at least know that much.
Ma'am, can you repeat what you just said?
What? Repeat what?
What you just said about SSRI?
I just said I was just giving an example and remember what class of medicines are being used for what purpose. So SSRIs are they used basically for OCDs and also for depression, and sometimes they're also used in conjunction with other antipsychotics for psychosis. So just remember that.
Ma'am, please can you repeat the spell of psychotherapy author's name? Corey, Hacker and Thought.
Corey,
What you said?
Corey,
Okay.
Corey. Yeah.
And other one, Hacker. What?
Hacker is HECKER, Hacker, and Thorpe is THORPE. I don't think
Okay,
Hacker and
thank you.
Thorpe is available in PDF form. I already had that book in hard copy, so that's how I got it. I don't think you would get Hacker and Thorpe in soft copy. So most probably you'll have to buy it. So it's better if you go with Corey. Okay. Yeah. Somebody was asking me something. Research methods focus on everything, don't leave anything. Somebody was asking me about some X factor. Can somebody read what it's written? I can't. I'm not able to like scroll down. No, you don't need to do any clinical internships. Just be thorough with what you're studying. That's it.
So the question asked is, do we need to enroll ourselves in some coaching factor to give an X factor, or we can do it by ourselves?
You can do it by yourselves also. If you're somebody who needs external help, then coaching will definitely help. I'm not somebody who's promoting go to a coaching or anything. If you feel you can do it by yourself, do it by yourself. If you have that kind of drive and that kind of discipline in your life that you can give this much time and you can study on your own and you don't need any clarifications with any topic. But if you feel that I still some parts of what I'm studying I'm not clear with, then coaching would definitely help with that. I started preparing. When did I start preparing? Okay, December 2020. I was preparing from December 2020, and some months I did not study at all. So I would say complete 1 year I have prepared, because some months I was not at all preparing. I did not have the motivation. Some months my sister got married in 2021, so those were the times when I was not able to. So yeah.
So I would like to ask, because you were saying all this, how do you keep, I mean, it's very difficult, but how do you keep yourself motivated and, like you keep giving exams and you don't get selected, and like your friends, if they get selected. So, this whole MPhil giving exams, this whole entrance procedure is very tough for, I think, everyone mental state, because it's very difficult to get in, first of all, and continuously studying and not knowing where you will get, and like the whole procedure is very taxing, applying to every college
Yeah.
individually. So how do you keep yourself going?
How I keep myself going is, I would say, I had to prove certain people, I mean, not certain
Hmm.
people. I had to um, basically, yeah, I proved myself. I would
True.
say that I had to get it. This is this, yeah. So this is what motivated me. So even if I lagged some days, I would tell myself, you can't really, not you. This is not you. And getting in was it was my dream, especially in enhanced. I mean, I really can't believe that I am sitting in NIMHANS while talking to
Yeah.
you all, when every one every once in a week I would always go through Google and see what NIMHANS looks like, and how's the campus and everything. So it is a dream come true definitely for me. And I think how I kept myself motivated is, I think, that picture of NIMHANS, I would say.
Yeah.
Yeah.
Ma'am, you said that you took a whole year to prepare for this.
Yeah.
Were you worried about the gap?
I did not take a year actually. I was in my master's. I got admission in my master's in December 2020. From December 2020 to July 2021, I was preparing as well as in my master's. Okay, so my master's got shortened by 6 months because of COVID. So during that time, while I was, doing my master's, I was also preparing. So I've never taken a gap year actually. I didn't get, yeah. So I just said that I was preparing as I was in my master's.
So should we worried about the gap because many of
No,
us have done
no,
their masters and
no, no. I have classmates who are coming here. They did their masters in 2018, and now they're here in after 4 years. In between, they were preparing. They were also working. You shouldn't be worried about that. There's nothing, I don't feel. Okay, if you have to take 1 year to prepare, that's more than okay. If you have to take more than 1 year, that's also okay. But just realize, this is is it something that we really want? Because sometimes um, we don't really want it, and we just ruthlessly driving ourselves towards it, and when we get it, we don't really feel like doing it. I have a lot of people in my class who feel in this way, so that's what I'm saying.
okay, ma'am.
Hello, ma'am.
Hi.
Hello, ma'am.
Hello, you want to ask something?
Hello.
I can hear you, Hasna.
Okay, ma'am. Ma'am, what kind of question asked in research methodology?
I told you usually it's about some design, research design. Um, it could be about difference between experimental, non-experimental designs. It could be about correlational design. So you need to be very much aware of how is experimental and correlational design different, how are they similar, and then about quasi-experimental design. That's it. Basically from research designs and about some variables. That's it.
Okay, ma'am. Thank you, ma'am.
Ma'am,
Yeah.
ma'am, what kind of questions are asked in interviews?
What?
What kind of questions are asked in interviews?
For interviews, I told everyone that usually it's a very basic question. So in CIP, they asked me about individual psychology, what is a perception means, which field do I want to go in, like in clinical psychology, what I really want to work as, like whether I want to be an adult clinical psychologist or an adolescent or a child clinical psychologist, and why. And then they asked me about what did they ask? Yeah, this is yeah, and one test they asked me about SFBT, segment form board test.
Okay, ma'am.
You cannot get the previous year's questions from anywhere, especially for NIMHANS. You won't get it. For CIP, so Fahim sir, the head of CISIUM, he gets the question every year, so you would get the question paper. Otherwise, it's not available.
Hello, ma'am.
Hi.
Ma'am, what kind of question we expect from history?
History, it's very broad. It's just some topic, something, some term that some psychologists have given, and they ask you that. So I cannot really answer that. It's anything and everything.
Okay, ma'am.
Yeah.
Schools of psychology, just like that.
Yeah, yeah, yeah. It means could be some terms, could be some theory somebody is given. Anything. Just read up on all of it.
Okay.
See, I don't know if it, who asked this question, but how I manage my master's MPhil, I was doing more than that. I was doing my master's, I was doing MPhil preparation. I also used to teach two students, and I had a very like 3 to 4 hour part-time job also. So I don't know how I managed. Seriously, I think I told this even in the beginning of the session. I just did. I divided my time, and I was very particular about doing it in that time. So it means even if it means that I have to decide which time I am going to eat, or what is the specific time that I'm going to eat, I decided beforehand about that also. So I was not wasting any moment. Like at least for 3 4 months, it was quite hectic for me while I was doing the dissertation and all of that. But I think I pretty well managed with time management. That's it. That's how I got it. So yeah. You guys have any other question? I don't think they're very broad. They're very only few psychologists, few functionalism, few behavior. Just study them. Goodwin. Goodwin is a very good book. It's, I would say better than Aaron. Structuralism, you just know about all the three people: Harvey Carr, Angel, and what's the third one? What is his name? Carr, Angel, and what's the third one? What is his name? There's a third person in functionalism. Just remember him also. Dewey, John Dewey. Okay, so remember his name. Um, remember William James, behaviorism, Skinner, and Watson, obviously, and also study about a little bit about two people who have actually sort of influenced uh, so behaviorism, especially classical conditioning. So read about Bechterev and Pavlov, both of them Russian psychologists. So if you read what's this book, um, A Kissing, you will be able to get it all the topics. Yeah, it's a very lazy Sunday. I'm so sorry. I just feel you guys. Yeah.
Hello, ma'am.
Do you have any other question? Hi.
I have general psychology by Byron. Is it enough to study?
No. If you have done Baron, you just for your own, for just for your own betterment, or how should I say, like if you want to understand more of the topics, because Baron doesn't have everything, go through Morgan and King as well. That would be really helpful. I'll be ending the session in 5 minutes. If you guys have any other question, please do ask. And if you guys have any other question, you can sort of um, message me on LinkedIn if you want. I will reply at my own pace. I can't give you my number because there's a lot of people, and my number is already there with my patient. I'm getting a lot of calls all the time, so can't risk that. So yeah, I can't give. But if you want to, if you have any other question, like you can text me on LinkedIn. I will definitely reply. Or you can ask Fahim sir as well if you're a part of CISIUM, and he would definitely forward the question to me, and I can reply back definitely. Rashna, you want to ask something? So guys, if you don't have any other question, I'll just end the meeting. If anyone of you has any other question, please do ask. Unmute yourself and ask, or else I'll end the meeting. Any question would be left. You need to ask any question.
One last question.
Yeah.
So, does our master's research paper play a role in if we get selected into places?
No. Yeah. Not for MPhil at least. For PhD, definitely it would help. When you go for an interview, it does help, but not for MPhil.
And the thing is, I actually did not get my research published for my master's. So, will that play any significant role?
I did not get my research published. I'm still in NIMHANS. So.
Thank you, ma'am. That means a
Don't
lot.
worry about these things. Don't worry. Yeah. Don't worry about research paper and everything. Just focus on your entrance. That's it.
No, ma'am,
Okay,
one
that is
another
what
question is,
decide. Yeah.
ma'am, my master's research paper got published, and if it will beneficial for NIMHANS or any other interviews, or it will take extra in
NIMHANS and RML, I know it will not. I'm really sorry, but it will not. CIP, maybe they might feel it's a good thing that you have, but as I told you, CIP does not consider interview as that important. The entrance gets 90% of the weightage. So if you do well in the entrance, you're getting in. Basically, that's the answer. If you do well in your entrance, you will get in.
Okay, ma'am.
Yeah. Like, I don't know about other private institutions or any other institute other than RML, CIP, and NIMHANS. But I think that if they are following it, most others are also following the same pattern.
Okay, ma'am. Thank you.
Yeah. Any other questions? There is no shorter book for Neeraj Ahuja. Neeraj Ahuja is a shorter book.
Ma'am, if it is not too rude to ask, could you please share your routine, like daily routine, what it is in NIMHANS training?
Oh, really? You really? Okay, so my daily routine is like days are basically so on Mondays I'm right now in one unit. So in that unit on Mondays we have so tomorrow I'll be having assessments, and then I have a case conference in the afternoon. And in between that, we have to go see our IP cases. If we have any OP case, we go to see that as well. On Tuesday and Wednesday, it's our OPD days. So OPD runs from 9 to 4:30, but it's that is the timing that they give. But it usually runs from 9 to 5 or 6, and we can leave early if we have a class. So other than that, we can't. And then we have to do our IP cases. We have to meet our patients that are who are admitted. Then on Thursday we have SR rounds, and on Friday we have consultant rounds. So we meet our patients who are there and we discuss our cases, whatever assessments or therapy that we are doing, we discuss it with the senior resident or the consultant psychiatrist. And then on Saturday again we have assessment along with academics. So every Saturday, either the JRs or us, we get a topic and we have to sort of do the presentation, and everybody listens and then they ask questions. So that is how it goes. And in between that we do get our assessments. So whatever assessments we get, we do it after 4:30. So that's how it runs. So sometimes some assessments they take a lot of time. Like I had one patient who the assessment was for 20 minutes, but he took 1.5 hours. Sorry, 2 hours. I forgot. So yeah, that also happens.
Oh, it sounds really interesting to all of us right now.
Yeah, it is interesting. I would say it is very interesting. It's 2 years of your life dedicated to one thing. That's it. But it's this job. If you're really interested in it, then it's something. It's like a, how do you say it? Khazana.
No, yeah, treasure.
Yeah, it's a treasure. It's yeah, like it's so many cases, so many different people. I think my first experience of being a psychologist came from the fact that I think I was medically oriented. So I saw a patient came up with a lot of headache and fits and epileptic seizures and everything, and I go to the psychiatrist and I'm like, sir, this is seizure, and we should take them to neurology and everything. And sir is like, yeah, okay, let's sit down, and they start asking the patient question. Comes out to that the person is having a dissociative seizure, and I'm like, what? Is it real? How did I miss this? So yeah, I mean, that also happens, and you do not really believe in the psychological part of it unless you really see it happening in front of you, and you can sort of make the connection between how a stressor in a person's life can sort of lead to all of these. And if only psychiatrists could sort of recognize the need to intervene also in there, then it would, be so helpful. But here, as far as in my unit, our consultant psychiatrists, the senior psychiatrists, they are always, they emphasize on, we can only give medications, but the most important part comes from therapy, and you have to get therapy, without which you will not be able to deal with your problems.
Yes, that's the main
So
thing.
this is something really good about NIMHANS, because psychiatrists, it's very difficult for psychiatrists to accept our field as irrelevant and valid, but here they do that.
That is very respectful for us. That's what we need, no?
Yeah. So that is one thing. So if you're coming to NIMHANS, you can at least expect that much from this place.
Thank you, ma'am.
Yeah. If you don't have, like, do you guys have any other question? You don't need to see it. So thank you. It's fine.
Ma'am, do we need the prior knowledge of therapies? And if yes, how to get it?
So see, the thing is, definitely you need prior knowledge, because sometimes what happens, they give you patients for therapy and they won't ask you whether you know it or not. Like, I have a active patient with BPD, borderline personality disorder, for whom I'm doing therapy. And even I'm not really aware of DBTs. I'm reading up and then going and doing it. So it's basically learning as you go. That's it. I mean, I do not have much knowledge about DBT, just the central tenets of it. Now I have to read deep on it and learn what exercises I can give her. So then, becomes a little difficult, because it's a huge book. You have to read it. So yeah, it's difficult. And BPD patients are very reluctant to talk about anything, and they start crying and it becomes a whole lot of mess. So you learn as you experience it. I think that's it. I mean, there's no book that will give you that kind of teaching. You make mistakes, you alter your therapy, you do another way, and if that works, you go with it.
Okay, ma'am. Thank you.
No problem. So I don't think you need a premium. What you do is you just send me we call it in LinkedIn, like, friend request or follow request. I'll accept, and then you can message me. Okay. Yeah, Neeraj, just 7th edition. Yeah, the green cover. It's a very old book, new edition has not come up. Doesn't matter, it's still very relevant. So just go through with it. I think there are no more questions, so I'll just end the meeting. Thank you, all of you, for such nice questions, and thank you so much for saying thank you. But yeah, it's just one way. If it's my way of saying thank you to Sir, because he's been really helpful in my journey. He's a really, of all, like a, other than being a very good teacher and very hardworking, he's a very good person also. So that's why I did this sort of session, because I owe him a lot. So yeah, thank you guys. Okay, bye bye. I'm just ending the meeting. If you have any other question, you can either message me or ask Sir, and he will forward the question. Okay. Thank you guys. Okay, I have to end. Ending. Just give me 1 minute, guys. Okay. You can leave if you want. Okay. Please start leaving. It will take a little time because this net is